I rise in strong support of this S-chip legislation, and I find it amazing that we have spent so much time debating it. This S-chip legislation would help more than 4 million children in this country get the health insurance they desperately need. But I should point out that it leaves approximately 3 million kids still uninsured. And Madam President, as you well know, the United States of America remains today the only major country in the industrialized world where this debate would take place. So we're spending weeks discussing an issue which every other country in the industrialized world has long resolved. So if we pass this piece of legislation tomorrow, and I hope we will, 3 million kids still remain without health insurance. And the common sense of insuring children is apparent to everybody. Because when you insure a kid, when you allow a parent to bring a child to a doctor, when a kid has access to medical care in a school, professionals can pick up the medical problems that kids have so that 10 years later, children do not end up in a hospital with a serious illness, and we spend hundreds of thousands of dollars trying to cure a child whose problem could have been detected when he or she was little. This really is a no-brainer. And clearly what we must do as a nation is move to a national health care program guaranteeing health care to all of our people, but a step forward will be passing this S-chip legislation. Madam President, I think the American people are more than aware that our health care system is substantially broken. They understand that not only do 46 million Americans have no health insurance, they understand that even more are underinsured. They understand the absurdity of tying health care to our jobs, because when we lose our jobs, then we lose our health care. And I think most Americans, and I hear some of my friends saying, oh, the American people don't want government health care. Well, you know what? Read the polls. The American people do believe that the United States government should take the responsibility of providing health care to every man, woman, and child, and I hope that as soon as possible we in fact do that. But not only do we have 46 million Americans, including many children, and that issue we are trying to deal with right now, have no health insurance, what we also are doing, because of the waste and inefficiency of our current system, we end up spending far more per capita on health care than do the people of any other country. And I know the chair right now, the president, is more than aware that General Motors, for example, spends more on health care than they do on steel in building automobiles. What kind of sense is that? So at a certain point that I hope soon, we as a nation end up finally saying health care is a right of all people. The absurdity that one child in this country does not have health insurance is an international embarrassment. Let's go forward and let's develop the most cost-effective way that we can provide health care to all of our people.